Okay, this is Dr. Trevor Haynes again, and today we're going to show you how to retape your bunion or your bunionectomy. So when we do minimally invasive bunionectomies, we do what's called a Reverdin Isham procedure. Your three incisions are usually going to be right here. This is where we shave down the bump, and we also make a cut in this metatarsal bone here. This one is where we take a little wedge out of the big toe that helps bring the toe over and get it corrected where we want it. And lastly, this little incision will be where we go in to release some of the tight contractures that contribute to pulling that toe over. So again, once we make those incisions, we're going to put something like a steri strip over these. Sometimes we'll use it. Sometimes this incision here may need a stitch or two, but most of the time we try to, again, just use steri strips. And then we'll get some gauze over the area. And then again with this one, you're going to start a little bit different than we've talked about in the other videos. You're going to start on the outside of the foot, and you're going to wrap around a couple times, and then you're going to come up around that toe, and you're going to pull that toe out. So go around the foot again, come up again around the toe, and again, pull that toe out. Kind of create a big gap between the first and second toes. Okay. And then we'll do the same thing with our Coban. Again, start on the outside of the foot, bring it around. Again, remember, we're not making this tight, so stretch it out and then lay it down. Don't crank it straight and hard right on it, because you'll create a wound over here on the outside of the foot. And then come around the toe again, pull it over, and then anchor it down. Again, do that a couple times. Over, down. And that's it. So you should have a nice big gap between the first and second toes, right? And that's how you're going to rebandage that if you need to. Obviously, you can continue wearing your boot, walking in your boot, but this, again, this is the bandage that's going to help maintain your bunion correction. If we don't have this toe pulled over, that's what keeps everything locked down and in and reduces that bunion. If we just let it float back over, a lot of times you'll have a higher risk of that bunion recurring.